Hello and welcome to a product showcase video for VetifyPro, NovaVet Family's AI Clinical Assistant. My name is Dr. Patrick Hombo. I am the Product and Services Director, and very happy to see you all here. What we're going to cover today is absolutely the impact of the clinical support provided by VetifyPro, how to add information to the algorithm, and how to generate the powerful summaries, both pet owner and PMS summaries. What we're not going to go over today is details on the admin of how to create appointments and such. This is covered in other videos, and in the length of time, we're just going to really stick to the outcome itself of VetifyPro. Okay, so let's jump straight into it. So we start on our website here. By clicking on account login, we get into the NovaVet portal. So here is the portal, and today we're going to be looking at VetifyPro. So we click on VetifyPro. Here is our basic appointment list. And so let's jump straight into an appointment, find our client, quickly confirm the client information. We are going to be doing a new patient today. We are going to choose an appointment time, we are going to choose a vet, and we're going to choose an appointment type. Again, the details of this is covered in other videos. So importantly here we are uploading our previous history. So today we're going to be uploading, pretending we're seeing a dog named Gia. So we uploaded Gia's history. And this is very important. This history is either downloaded from your practice management system or it comes with the client if they're coming from another clinic. Very importantly, most vets, don't have time to read this whole history. So here you can just upload it and the algorithm takes it into account for its recommendations. Okay, so we finish here, we go into our consult, and let's add Gia's information. So we click edit up here. So we say she's Gia, let's say she's 6 kilos. She is a dog. She's a Bichon Frise. Again, we could click this here, but let's just pretend we're just quickly typing, and let's even pretend that we misspell it, Frissy. And it doesn't matter. You can just quickly put it in. We'll say she's female. We'll say she's neutered, and she is about 9 years old. So you can just click any old date here. So she's about 9 years old. Okay, so let's save this. And now let's jump straight into the consult. So let's start the consult. So initially, we are going to get a little preview here before even writing any history or physical exam. So before the vet even walks into the room, they can generate a little summary. So we see here that we are in Dubai. You notice I did not write that, but the VetifyPro automatically takes your clinic's location into account. We see our prior history summary that in 2023, we had hemorrhagic vomiting diarrhea. We were hospitalized in December as well, and some summary of what was given, and with some passing of bladder stones. So right away, we get a nice little summary of the prior history of the animal. These can be very important things as you walk into today's consultation. Some notes from the signalment, and some other notes. And so, right away, we're getting some initial information here. So let's go into our history. Why is she here today? Let's say that she's lethargic for a few days. And you can see as well, I can misspell today, very bad, not. Let's say something just like that. You can, of course, be as thorough or as normal as you'd want. Summary, let's add a quick physical exam. We'll write quiet, QAR. You can mucous membranes pale, panting, T equals 39, abdopalp, NAD. Something just very quick like that. We also have a checklist here for newer vets if you would like. We could maybe put in dental gingivitis, for example. However, you don't have to do that. Now let's regenerate our results. So this is the core cycle of VetifyPro. You add new information and you regenerate results, and you can keep doing this over and over and over. You can add new history, you can add new physical exams, and you can add new diagnostics or anything else, and it will regenerate the recommendations. So let's once again look at our output, and this is in a sense the core output of VetifyPro. So we have our initial information, which is our summary of the consultation, the prior history, and the current data. So we say that we're to buy, we have the summary of the history here, and we have our animal data with the presenting problem, the exam. Immediate steps reassessment. So these are items that we may have missed in our physical exam or our owner questioning, and important sort of emergency type steps that we would want to take right away. And we can see that here in our physical exam. We did not write in our heart rate, our rest rate, and our blood pressure. Very, very important. A PCV TP, very, very important, as we're saying the animal is pale. Asking the owner for any vomiting, diarrhea, toxins, very important. The hydration status, important. And a blood glucose, yes. So these are all things here which are very important. Could be really nice to just see these things pop up. Then we jump to our differentials. Of course, differentials are an important part of any case, although, they are not always the be-all and end-all of a case. IMHA jumps first to the list with a little bit of a rationale. Pale mucous membranes, prior hemolysis raises, may require immunosuppression. Acute GI bleed, rebleeding, toxin-related relapse, atypical Addison's, and anemia of chronic disease, all sort of differentials here. VetifyPro will give you about 4 to 6 differentials. It won't give you 20, but with a few diagnostics, it zeroes in very, very quickly. We have a budget tip here, some potentially for newer vets, although could be useful for anyone. Sort of in a budget situation, what are the diagnostics that are the most important to prioritize right away at this point in time. And again, we see PCV, TP, and a blood smear before running full panels to check for that anemia, really the main thing here. I totally agree. Further diagnostic testing. In this case, we haven't done any diagnostic testing, so I think these all make a lot of sense right away. Again, once we start doing diagnostics and we're looking at further diagnostics, it zeroes in on other specifics, but right now, all of this makes sense with a, in a ordered list. So, let's start with the CBC, sure. Hospitalization or discharge, basically giving us a little advice on does the animal need to stay here or not. And in our case, we're saying pale mucous membranes and panting, suggesting moderate to severe anemia. It needs fluids, serial PCVs, and close observation. Yes, I agree. Medication suggestions. Again, in this case, we haven't really zeroed in on a differential or a diagnosis yet, but it's still giving us suggestions. Antiemetics, gastroprotectants, if PCV, consider a transfusion, etc., etc. Finally, other recommendations is sort of anything else that doesn't fall into those categories we just discussed. Broken down into short-term and long-term. And then a final summary. So let's give it some diagnostics. So we have our diagnostics upload screen here. So we can upload a test. You could also just write in anything here. You could write in something like CBC normal or USG 1020. Again, you don't even have to spell it right, so let's just write in, you could write in anything and then you just add it to the document. In our case, we have the CBC, GHP, and urine, although we could, let's say, write something like 4DX negative. Let's say we happened to run that. And again, we can misspell it and let's just add that as well. And so now if we want to look at the blood results, we can look at them here, or if we want to see what we wrote, we can look at that here. Okay, so let's now say that we ran some bloods, and now let's regenerate the results. And so we haven't even looked at the results, but let's see what we come up with here. Once again, we're going back to the core upload new information or type in new information, whether that's diagnostics, physical exams, or history, and then you regenerate the results. So once again, we have our initial information, although now we've run some additional diagnostics saying that we've done this on July 7th, which is today. We say that we have 4DX negative. CBC, our hematocrit is 26% with reticulocytosis, mild thrombopenia, and some other information here. And you can read these yourself. So once again, going back to the immediate steps or reassessments, what are the things we should be looking at right away? Confirming the vaccine status for leptospirosis makes sense. Repeating the physical exam. We still didn't write in things like our dehydration percent. Looking at Coombs test or saline agglutination to support this IMHA diagnosis, because with reticulocytosis and hematocrit of 26%, regenerative anemia, no question that IMHA is our primary differential here. And here we can see why. Regenerative anemia, hyperbilirubinemia, hemoglobinuria consistent with antibody-mediated RBC destruction. And saying that this is often an emergency, also nice to hear. However, it could be secondary, and we have some other differentials on here as well. Further diagnostic, we can now see that we have changed from just your standard bloods to saline agglutination, blood smear, radiographs. Yes, all of this makes sense. Hospitalization discharge, relatively the same. Medication suggestions now much more specific. Prednisolone in 2 divided doses, monitoring, looking for thromboprophylaxis, omeprazole, again, much more specific medications based on now a much more zeroed in diagnosis. Finally, the other recommendations, short-term and long-term, talking about steroid tapering, et cetera, and then a final summary and budget consideration. And we can now keep doing this as much or as little as we want. We could keep adding in new history notes, new physical exam notes, new diagnostics. We could keep this animal in hospital for a week, and we could keep adding new information. So the cycle continues, okay? Very, very important. We also have a free form chat here on the right. So here we can write anything. We could write, I would like more on IMHA. So sort of your textbook type questions. I would specific questions based on the case at hand. So is primary, okay? So once again, you can ask specific questions about the case, or you can ask general questions as you would from a textbook. So that's very nice to have in combination with the rest of the results. So let's now say the case has ended. So once the case ends, we will create a full report. So what the full report is it is a comprehensive report about everything that happened in the case, especially in cases where there is an extended timeline. Again, you have an animal who has been in hospital for the whole day or multiple days, for example. The full report will give you a timeline of events. So a timeline of physical exam findings, a timeline of diagnostics, a timeline of whatever, medications. And this is meant to allow the vet or a colleague to come back to the case and really see comprehensively everything that has happened. Okay, so into our full report here, we can now see the full report. So we have the timeline of events from the previous history, the clinical history, physical exam, et cetera, and we can see, again, sort of a comprehensive view of the case. So this is nice if you really want to get into the details. Like we said, though, in many cases, most cases, this is too long to immediately transfer into your practice management system. This is editable, by the way. You can type or write in whatever you want. But we want to now get this information back into our practice management system. So let's generate the vet summary. So this now takes that comprehensive report and turns it into a much more concise and SOAP note formatted summary to go back into your practice management system. So this would be what you copy back in. So here we can see a much more concise summary. It's, again, editable to whatever you would want. And you can see here it gives us a node of subjective, objective, assessment, and plan, and a bit of communication. Okay, then we can either copy and paste this back into our practice management system, or we can download it and download it as a PDF if we wanted to send it on to a colleague or something like that. But most of the time, you would likely be copying and pasting it back into your practice management system. Additionally, we can generate the pet owner summary. So this now takes the same comprehensive report, but creates a summary that is meant as an email, or it's formatted as an email to the client. And this is very, very powerful in both increasing client compliance if you're sending them home with medication, but also improving the value perception of the consultation or the case. These days, clients absolutely demand more and more higher level care. And by being able to send them a quick, being able to quickly send them a quick email or WhatsApp is very, very powerful. And so here we can say, thanks for bringing Gia to Patrick's test clinic. We know it can be worrying. This is what we've done so far. This is our treatment plan, what to expect next. Of course, as we said, it's also editable. You can delete the whole thing, or you can type in your own little note. Finally, you would copy again and paste into your practice management system. Copy and paste into your email client or WhatsApp. So that's a nice rundown of VetifyPro. We finally end the consultation once we're done, and we pop back to our appointment list. I think this gives a quick but still powerful view of VetifyPro and the impact it can have on the clinical support and the confidence for your veterinarians. My name's Patrick. See you guys in the next video.